Hi, everyone. My name is Jessica Farrell. I'm a clinical pharmacist at Albany Medical Center Division of Rheumatology and professor at Albany College of Pharmacy and Health Sciences. I'm also a member of the board for GRAPPA, and I am really excited to talk to you today about a medication question in terms of the efficacy of Ixekizumab across the GRAPPA domain. So if you're not familiar what GRAPPA is, GRAPPA stands for a group for research and assessment of psoriasis and psoriatic arthritis. So some of you might be familiar with the recent GRAPPA guidelines that were updated, and the focus of their guidelines is very specific to the efficacy domains, which include peripheral arthritis, axial disease, enthesitis, dactylitis, skin scores, and then nail psoriasis. So when we think about, and when we look at using Ixekizumab, I'm going to go through each of these domains and just highlight Ixekizumab's efficacy. And when we start with peripheral arthritis, so some of our patients with, or many of our patients with psoriatic arthritis, at least when they come to rheumatology, they generally have peripheral arthritis to some degree. So Ixekizumab has been shown in the psoriatic arthritis trials to have significant efficacy over placebo when we look at ACR 20, 50, and 70 scores. So in most of these clinical trials, we're looking at their Ixekizumab compared to standard of treatment. So that might be conventional DMARDs. But overall, their Ixekizumab does have higher rates of all of those ACR scores when we look at peripheral arthritis, which is great. In terms of axial disease, so some of our psoriatic arthritis patients, not all, have axial disease. So when we do have those patients with axial involvement, we want to know, is it going to be efficacious? So in the clinical trials with Ixekizumab, the axial spondyloarthritis scores, so the ASAS 20 and ASAS 40 responses are what that measurement that's used, and it's 20% and 40% improvement response from baseline based on those domains that they use to assess axial disease. And Ixekizumab has shown improvement in significant improvements in both of those domains too, which is also great to tell our patients. Enthesitis, so some patients, their primary complaint might be enthesitis. So commonly we'll have patients complain of heel pain or enthesitis. They have enthesitis in that Achilles tendon. And essentially for those of you who may be new to rheumatology, enthesitis is the inflammation in the tendon or ligament that where inserts to the bone. So like I said, the Achilles tendon is generally the most common place that patients complain about it. And Ixekizumab has shown efficacy in resolving enthesitis, and a significant amount of patients have had complete resolution of enthesitis compared to placebo in clinical trials. So that is also a great thing to tell our patients, especially if that's their primary complaint. When we look at dactylitis, so dactylitis is the swelling of an entire digit. And I actually learned this from my attending rheumatologist the other day, is that it's actually the inflammation of the tendon sheath that goes around the digit. So that is something that some patients have where they have just like one swelling of one digit. Oftentimes it's the ring finger. And that can just, I remember when I was learning it and initially in rheumatology, we called it sausage finger. And that can be a challenge, especially if they have that one very swollen digit. Ixekizumab has also shown to be effective in substantial reductions in dactylitis severity scores and a higher percentage of patients achieving complete resolution of dactylitis compared to placebo. And then when we look at skin, so Ixekizumab is amazing at clearing skin. We will see very quick responses with skin scores. So skin scores that we use are POSI. So POSI stands for the Psoriasis Area and Severity Index. So the POSI score in clinical trials, what we're looking at is 75%, 90% clearance, and even 100% clearance. And Ixekizumab has shown efficacy superior to placebo in all of those areas, all of those measures, so 75, 90, and 100. And it is very cool to tell our patients that in a subset of patients that have been studied with severe psoriasis, we've seen 100% clearing of their skin. So, the patient's goal might be 75% clearance, maybe it is 100% clearance. And this medication has been shown to be able to do that in clinical trials. And then the last GRAPPA domain is nail psoriasis. So I do have patients that do complain about that, especially where they have significant pitting in their nails. And this can be just cosmetically very frustrating, especially for our female patients, and they can have challenging when they go to get their nails done at the salon. So it is good to know what the nail scores are. And the score that we use in clinical trials is called the Nail Psoriasis Severity Index score. And ixekizumab had also demonstrated significant reductions in those scores. So if you're new to rheumatology or new to reviewing all this literature, these are all, so depending on the clinical trial, depending on the specifics of, the objective of the trial. In psoriatic arthritis trials, we'll usually use the ACR scores and the POSI scores. And obviously the plaque psoriasis studies will use just the skin scores. But the rest of these measures are usually secondary. But it's helpful to tell our patients, because I find that if I put 10 of my psoriatic arthritis patients in a room together, they may look very different. So it's helpful to know if, these other domains, if they have those complaints, and that's what their focus is of what they want improvements are, that we can tell them that treatment with ixekizumab specifically can lead to significant reductions in all of those areas. So that I find that very helpful to dig into those secondary outcomes. I hope you do too. And if you need more information, you want more information, please visit the WRAP website. We also have the WRAP app, and we also have our annual conference. So I hope I will see you there too. Take care.